Where's the last place you received healthcare from, Chibuike?
I can't remember.
Oh, yeah? So,
I really can't.
are you one of those people who say, oh, I rarely fall sick, I never have to go to the hospital?
I don't know about that, but thinking about it now, I think it was Dida Hospital. That was the last place.
What's Dida Hospital?
It's a specialist hospital somewhere in Katampe, Abuja. For our
Wait.
listeners who are not in Abuja, yes. Yeah, one Sunday, I remember. One Sunday I had a fever. A friend had to take me because it was that serious.
Wait, so I'm still stuck at the part where you went to a specialist hospital for a fever.
It's a very sudden, unexpected, and scary fever. Okay, any fever as expected, but yeah, it was scary. I mean, I had to save my life.
Wahala. Sorry. This is a very important conversation to have. Is it any health facility that you can just go to for emergencies? Where should you actually go to receive health care? There's this I think it's called Cardio Care Hospital, somewhere in Abuja that I drive past a lot. And I remember wondering if they accept like just any patient, like if people can just walk in or if it's only referrals that they deal with. Anyway, please know that there is a structure for how we should actually access healthcare. It's not everything that you should be running to a specialist hospital for, like Chibuike.
Please, dear, I love my life, but I do agree with you, and I'm glad that we're going to be breaking it down on today's episode of the podcast. I am your co-host, Chibuike Alaboso.
And I am Asari Ndem. Before we introduce our guest today, Chibuike, what is happening outside the Break It Down world?
Okay, so from our top 10 health news last week, because that's where we get our, just one thing something that happened in the health sector. Was this news about religious and traditional rulers appealing for primary health centers in their communities. I think in the FCT. Yeah, I think it's really cool. And it's quite interesting that we're going to be having discussions around that on today's episode of the podcast. So the moment we have been waiting for, I'm delighted to introduce a very passionate grassroots public health advocate, Chika Offor. Yeah, really. Do we have a clapping? We should have a clapping.
Like a little clapping sound.
Effect, or sound. Yeah. But yeah, really great to have you on the show, Chika. I still remember something you said during the Nigeria Health Watch event where you advised participants to adopt a PHC. So beyond all the advocacy and conversation, so you adopt a PHC that you sort of look out for. When things are not going right, you call it out, call the authorities' attention to it. But yeah, can you tell us more about all the great work that you do, more about yourself and some of the great work that you do?
Okay, my name is Chika Offor. I'm the CEO of Vaccine Network for Disease Control. I'm a mother of 3 children with a very supportive husband, and I'm a vaccine advocate. I'm a grassroots advocate. I'm a community advocate. We believe in community health and development for all. And we believe, truthfully, that anything that disrupts development is the disease. And anything that supports development is the vaccine. So to us, vaccine is not just about vaccination. It's about prevention of any kind of thing that would disrupt development, So because of that, we see primary health care centers as a vaccine to solve many problems, So we see communities as the people that should be served to make sure that they are okay. They are the people we serve. They are the people that need to go to the primary health care center. These are the people that need to take the vaccine, So the vaccine of health, the vaccine of nutrition, the vaccine of education, the vaccine. So at the end of the day, we are going to have healthy, well-protected Nigerians who can do great things.
Thank you so much for joining us today and for offering up your expertise on the subject. So, in your experience, do people generally access healthcare in the places where they are supposed to?
The truth be told, they do not.
Mm.
They do not access healthcare because a lot of things have to do with information.
I see.
There are many clogs in life.
Mm-hmm.
One big clog that the devil uses against us is lack of information.
That is true.
When you do not have information about a primary healthcare center, when you do not have information as to the places that you go to that can cater for your health, that can give you the preventive health approaches that you need, then you go somewhere else. And then when the primary healthcare center is also not ready to receive you, in the sense that you go to a primary healthcare center, you are not feeling okay, and then you enter a primary healthcare center, the nurse asks you to pay for card.
That's true.
You don't have money for card. You get there and they say you are ill, there's nobody to test you. Then they prescribe, they tell you to go to the chemist to buy. Whatever it is that they tell you to take, you're not sure about the personnel who is even talking to you. And then you go out to go and buy. You find that you spend a lot of money doing all this back and forth. But then again, when you go to a tertiary institution or a secondary institution, you won't go through that. You will go through a structured system, a system where you will get the right kind of experience to an extent, not perfect, but to an extent. You will see a doctor, you will see a nurse, you will get information as to the state of your health. And then when you follow the instructions that the nurse or the doctor has told you, you will get better. Next time, will you go to the health center? No, you will not go. You will go to the other one.
Yeah.
And we have examples of a community where I support, Damangaza and many other communities. We had twin girls who were ill. At that time, the primary healthcare center in Damangaza was not okay because they didn't have light. They didn't have no electricity. So what was the point of going there? They didn't even have staff. So they had to go somewhere else, and they were treated shabbily because they were from the north, and then the primary health center felt that they were not properly dressed, dirty or something, so they were not properly treated. So they started treating themselves. They went to the chemist nearby, treated themselves. Before we knew it, the twin girls died.
No.
The first one died first. The second one we took to Asokoro General Hospital. And then in Asokoro, they discovered that she had, they said typhoid, they said pneumonia, they said different kinds of things. At the end of the day, they did about 4 operations on Hassana, and then she died. So tomorrow, do you think Hassana's father will go to the health center?
No, absolutely not.
So these are the issues. Because if they had gone to the tertiary institution, or if they had gone to the secondary institution from the beginning, they would have gotten a more proactive response.
Yeah. Thank you so much, Chika, for sharing that. That's really touching, and
it really makes you think.
Yeah, those are some of the stories we hear, from our health space. Of course, there are also some things that are working or things that are supposed to work, like government policies that clearly outline where people are supposed to receive healthcare. And you've already, sort of giving us a good intro into the conversation by saying, this is where it should be, but people are not really going there for certain reasons, like quality of care that they receive. But what are some of those policies? Like I know the National Strategic Health Development Plan too. What do such policies say really about where people should receive healthcare, where people should access healthcare in Nigeria?
Thank you very much. It's a very beautiful question. What does the National Strategic Health Development Plan, what does it say? In simple terms, I like to be simple.
Yes.
It's a plan that talks about ensuring the healthy lives and promoting the well-being of Nigerians. Health and well-being of Nigerians. That is the outcome that we're expecting from this plan. And the beautiful thing about Nigeria is that very group of intelligent people. So you have critical stakeholders, Ministry of Health, MPHCDA, some private partners, everybody coming together to develop this very robust plan. So we had the first one, and this is the second one. Yeah. And the first one did not look too much into the M&E part of it, and certain other aspects were added into it to make it more robust. But then again, from the first plan, we were able to pull out the National Health Act, then the Basic Healthcare Provision Fund, PHC under one roof, let me not talk about all these very big verbose words. Let's break it down.
We'll break it down.
Because that's what we have come to do here.
Yes.
Break it down.
Break it down.
The primary health care center is the nearest health center to communities. It's supposed to be the first level of care.
Yes.
And all these things are talked about in this document. So at that first level of care, when somebody is not feeling all right, you're not supposed to jump into the secondary health secondary institution like Asoko General Hospital, like National Hospital. You're supposed to go to the health center that is near you.
Mm-hmm.
And then it's only when they cannot solve that problem, they find that it is beyond what they can do, then they will refer you to the National Hospital, to the secondary institution. Mm-hmm. That is how it's supposed to be. And all this strategy we're talking about, and many other strategies that concern the health and well-being of Nigerians is inside this document.
I see.
So the first thing is, once you do not read the document, you do not know what they are saying. So that's the first thing.
That's true.
So this document is not a small document, it's like 100 and something pages document. Wow. What it means is that all the strategic partners have to have this document, read this document, understand this document, put it into simple terms, share some passions of this document in primary health care centers so that everybody in one glance, in one place can see exactly what it's all about. The Basic Healthcare Provision Fund, which is an output of this document, talks about the fact that every Nigerian is supposed to have basic health care, which starts from the primary health care center. They went as far as forming every state, the 36 plus 1 state in Nigeria, they all have every ward has one basic healthcare provision fund facility. To show you as an example of what a primary healthcare center is supposed to have, is supposed to be, is supposed to achieve. It's a catalytic thing. So that when others see how they are supposed to be, the staff, the kind of staff they're supposed to have, the kind of drugs that they're supposed to have, the kind of treatment they're supposed to treat people, the expertise that is necessary, the infrastructure, that is the way the whole thing looks. Once you go there and you see how it is and it is working, then every other health center is supposed to copy from it. And then you're supposed to act as a catalytic fund. No, let me use a simpler word. As a fund that will encourage other health centers to be the same.
I see.
And then we have what they call the whole family approach. By the time the health centers are ready, that is, the health centers are ready, they have staff, the structures are good, they have lights, they can give vaccines, they have everything necessary, courteous staff, not just staff. Then somebody from the facility, from the community, which is around them, because it's one of those primary healthcare ones, basic healthcare provision one per ward. When it's time for you to go to the facility, you can. Father, mother, child will all come together, make it like a family outing. Daddy can go and check his BP level there, take his COVID-19 vaccine. Mommy will check her reproductive health services there, take COVID-19 vaccines. The baby that she has will take routine immunization, check the baby. Then the teenager will take HPV vaccine. In one visit, they just visit the health center and they'll be able to achieve all these things. Yeah. So the health center becomes like a family visit. You can plan it. You now go there. You know what I'm saying?
Yes.
A family visit, and you will achieve all these things. If this is what has been happening, we will not have any problem with people visiting the health facility.
No, I think you're right. Yeah. I like it. It's very, I really, I like seeing the vision.
Yeah, I really like that.
And that's what we should focus on. That's what we should focus on.
Yes.
That's what we should charge charge the Basic Healthcare Provision Fund and this strategic health development plan to make sure that it's achieved, because there's an M&E component. And when you say M&E, let me break it down again.
I really like that you understand the assignment to break these things down, not to talk about them in a very complicated way. It's just as simple as possible, so people get
as simple as possible. Yeah. To track the progress. All these things we are saying, to track the progress. PHC under one roof, is it working? Basic Healthcare Provision Fund, is it working? You will have things you use to track. Is the building up to the standard because there's a standard?
Mm-hmm.
Do you have the number of staff that is necessary?
Mm-hmm.
Do you have drugs, basic drugs that they can take?
Yes.
Do they have courteous staff that can encourage a repeat visit where necessary?
Very important.
Very important. You know, all these kind of things. Do they have a good referral system to the secondary and tertiary facilities?
Mm-hmm.
Do they have? And then when they refer, do they listen to them? When you refer somebody from the primary healthcare center to Asokoro, will Asokoro attend based on the referral?
Yeah.
These are very simple things.
So I think you've
very simple things.
Chika, thank you so much for these insights. You've actually gone into the next big question that we have, or the big elephant in the room, which is how much do we adhere to this
to these policies?
What these policies say, that way of saying, breaking down where people should go for healthcare, primary, secondary, tertiary, and who should be held accountable when they are not adhered to. Please.
For now, one thing for sure is that the citizens of the Republic of Nigeria, who are the people you should serve, should not be held responsible.
Mm-hmm.
For one, you know why? When something is working, you don't have to tell them to go there. They will go there.
They just go.
They will just go.
Mm-hmm.
Like now, even in my office, we have told our staff that instead of having the normal health insurance, we're not getting insurance, the that's NHIA insurance we're getting now at the health facility. We're not using the one at hospitals, we're using the primary health care to test the process.
I see.
To test how it works. Because with, I think FCT is 12,000 naira or so, you can access basic health care for 1 year. Okay. So if, for instance, first and foremost, the amount of money that they're asking for is 12,000 naira for FCT, let's start from there. The federal government is saying 8,000, but different states have different amounts of money that they are, that they want. So if you now say a family should pay 12,000 per child or 8,000, let's even go to the first one for a whole year.
Mm-hmm.
So what it means that a family of 5 would pay 8,000 times 5, which is 40,000. Yeah. That is to go to the primary health care center.
Mm-hmm.
Before a Nigerian who doesn't have money, who is poor, who you are saying should not break the bank to access care, who agree to do that, the person must see and trust that system is working.
You're right.
That's one.
Mm-hmm.
And then if they have tried to go to the primary healthcare centers in the past and they didn't see it working as they want it to work, they would not support that system. The people you are supposed to serve feel that you're not serving them well, then they will not pay for that service. They rather go to the secondary institution where they are sure that they will get some form of experience there.
Mm-hmm.
You get what I'm saying?
Yeah.
And that is key. I have something else that I really need to add.
Oh, please add.
Adopt a PHC.
Everybody should adopt a PHC.
Adopt a PHC and monitor. Let me tell you what we did in my organization together with IHP.
Mm-hmm.
What we did was I'm a member of many women organizations, and then we sold to them this adopt a PHC approach and whole family approach that I talked about.
Mm-hmm.
And they were very excited about it. I told them, adopt a PHC. We're not asking you to break the bank. You can just say, okay, I want to visit this PHC. I'm only contributing sugar testing machine or something. If I have more money to change the facade or to do borehole, so be it. Adopt it and monitor it. It's only what is adopted that can be monitored.
Yes.
So, and the women bought into it. As I'm talking to you now, we have some women who have businesses near primary health care centers. Some of them have adopted the primary health care centers. We have Biobac.
Oh, that's nice.
That's nice.
You know Biobac in restaurant.
Oh, with the lovely moi.
Biobac has adopted, oh my God, one facility at Gadua.
Oh, wow.
Yes. And if you see, as I'm talking to you now, the facility is not fenced. So a lot of tests, so many things are not happening there.
Mm-hmm.
They even attack the nurses who have their nursing place around their tips. As I'm talking to you now, Biobac has decided they are fencing the whole place.
Oh.
They've adopted it solely, and they said that they will pay for one staff forever.
Oh, wow.
Then, yes, they're going to gradually start to implement, give them different things that they need. They're together, together with FCT, Primary Healthcare Board. So we divided it. There are some things that the Primary Health Board is supposed to do, and there are some things that BioBank is supposed to do, and there are some things that we are supposed to do as CSO to monitor the whole process. It has been divided, and BioBank is doing her own now as we are speaking.
Honestly, that's incredible. I wish we had like a little clapping machine because this deserves a round of applause.
Wow. And that's what we're doing. Many people are started saying they want to adopt. 3, 4, 5 people are coming together to adopt one facility.
Oh, that's very nice.
Yes. And then in that particular program, Professor Putomori was in that your program that I talked about adopt a facility.
Yes.
Professor Putomori has adopted a facility in Ibadan.
Awesome.
Anna, I love it. Well done.
Yes.
Thank you so
So
much.
you see, this adopt a facility, the approach I talked about, is also catalytic. We want everybody to adopt a facility. Yes. By the time you go there one day and say, what happened to your PP machine? Why is it not working? They will repair it. By the time another person comes, this thing is not working. By the time I third person, before you know it, it will be about us as Nigerians.
Wow. Thank you so much for these insights. So now you know that you shouldn't be going to a place like FMC, that's Federal Medical Center, for instance, for headaches. Please always start with the primary healthcare center around you.
For a moment, I thought we were going to say not to go to Federal Medical Centers for headaches like some people. Well, I'm glad you were nice and didn't.
I'm a nice person, Chibuike.
Please don't let it get to your head. Okay, yeah, but yes, like Asari said, even when the PHCs are not functioning, or that's first place you should go to before going to the specialist places. When those places are not working, ask questions. Ask your state government, ask your local governments. Why are these things not working? It's not everything that the federal oversees. They are also responsible for healthcare at that level. So ask questions, engage with them.
That's actually a really strong call to action. As we usually do, we want to send a shout out to the NPHCDA, that's the National Primary Healthcare Development Agency, for all the work they do in strengthening PHCs around us.
That's right. Thank you for all the great work and keep it up. So yes, that's it on today's episode. Thanks so much for listening. Thank you so much, Chika, for making our time to share these insights with us. I remain your co-host, Chibuike Alaboso.
And I'm Asari. Please share this episode with your friends and share your feedback with us using the info in the description. Till next time, break it down. Bye-bye.
I thought you said you wanted us to say bye-bye together.
You're so funny.
Which one do you want? You said you wanted us to sign out together.
But you're the one that told me that we need a sign out.
Then you now quarreled with me because of bye-bye. Ordinary bye-bye, you. Ordinary bye-bye. That we did not say it together as co-hosts.
All right.
So which one should we say now?
We're finished.
You're not saying anything.
Till next time.
So we'll leave this part. Michael, please don't cut this part out. You know that thing you used to do where after the break it down, after the sign out song, you put something. Put
this could be our blooper.
Yeah. What did you call it?
Blooper reel.
Oh, okay.
Yeah.
So yes, we can use it for whatever it is that Asari called it. But yeah, it's cool. Yeah. So you see how some people used to stress me on this podcasting.
Only thing I've done is to be a good girl.
And